Welcome to Antenatal Faith Clinic. I am Nurse Z, and on this channel, I bring videos with focus to human health, pregnancy, labor, reproductive healthcare teachings for all ages, as well as healthy tips for those who are trying to conceive. And if this sounds like what you love to hear, please click the subscribe button, hit our notification bell, so you get notified each time I post a new video. Today's video will be focusing on an interesting aspect of the family planning method, which is the long-acting reversible contraceptive method. Long-acting simply means that this method is effective for a long period of time. It's effective for more than 1 month, going into years, and for a long period of time. It is reversible because whenever you decide to become pregnant again, it can be removed at any time. It is not a permanent method of family planning. That is why it is called a reversible method of contraception. The first method on my list today is the progesterone injection, which is given on the arm or around your buttocks area. It is 94% effective if taken according to the schedule, and it is taken every 3 months. It is administered by only a licensed and a trained personnel. Majority of women that use this method may experience amenorrhea, meaning that they may stop seeing their period. Their period may come, but it will not flow as usual. It may come scanty, and little. The method does not interfere with sexual intercourse. For some women who may be forgetful about taking their daily pill, this method takes away the need of always taking pill every day. The injection is usually given within the first 7 days when you begin your menses, or when you are confident that you are not pregnant. That is when the injection is given. One of the side effects of this method is that it can cause irregular bleeding, some hormonal side effects such as increased weight gain. So if you are the type that I don't want to get so big, this method may not be appropriate for you. The side effect of this method is mood swing, mood changes. There's also a change in your appetite. Injection can also predispose this woman to having what we call osteoporosis. That's a reduced bone density. And most times, she begins to feel bone pain, waist pain, joint pain, and all that is as a result of the side effects from this injection. And you also need to talk to your health provider so that you can be guided on the appropriate method suitable for you. Now hear this. It could take up to months and a few years to conceive after you stop taking this injection. So if you wish to become pregnant, you may need to stop taking this injection earlier, a few months, when you plan to take in. No, you can become pregnant if you miss the dose of any shot, and also if you take it late, you can become pregnant. One of the long-acting reversible contraceptive method is the Intrauterian device. This method lasts for several years. It is a smoothie-shaped structure that is inserted into your uterus. It is very easy and convenient. It does not interfere with sexual activity. No, it does not. IUD is of 2 types. We have the hormonal IUD and the copper T. They work mainly by preventing fertilization of both the egg and the sperm. Progesterone in the hormonal IUD causes cervical mucus to be so thick and then interfering with the movement of the sperm, making it hard for the sperm to enter into the uterus. The hormonal IUD is effective for up to 5 years and comes in different forms and
pelvic
sizes. Examination will be required before an IUD is inserted into the woman. 50% of women who use the hormonal IUD experiences less painful periods, and then their period may be irregular or will stop completely. It is easy to use. It can be inserted anytime after a miscarriage, after childbirth, after a cesarean section, even while you are breastfeeding. It can be inserted at any time. There are also few medical problems that can prevent you from using this method. Trying to get pregnant as soon as you remove the IUD. It does not affect your ability to get pregnant in the future. Over time, hormonal IUD decrease menstrual pain and heavy bleeding. IUD, when inserted, can last up to 10 years. It is the only IUD that can be used as an emergency contraceptive method. It is the opposite of the hormonal IUD. It has no hormonal side effects like increased weight gain, acne, osteoporosis, irregular menstrual bleeding. However, it can make your period more crampier and even heavy. After insertion of the IUD, you may feel a little mild pain. Taking analgesic is advised. You may also experience little spotting. The strings, that is the rope, should not bother you, but if it becomes a concern to your partner, you may need to return to your health provider so that it can be properly trimmed. From time to time, you may need to check to ensure that the strings are intact to avoid issues of missing IUDs. And then while you have your IUD on, I advise you adhere strictly to proper vaginal hygiene, because the presence of the IUD is already a risk factor for urinary tract infection. So while having your IUD on, you maintain good personal hygiene. If you're already pregnant, if you have any uterine abnormalities, any abnormal bleeding from your vagina, urinary tract infection, this method is completely not for you. May need to visit your health provider or call your doctor if you experience any of this while having your IUD. Severe abdominal pain, unexplained fever, unusual vaginal discharge, when you miss your period or you tested positive to a home pregnancy test, you may need to call or visit your healthcare provider. The next method of the long-acting reversible contraception is the implant. Implant is effective for 3 years. It is made up of a tiny rod, looks like a matchstick. It is inserted under the skin on the upper arm and it releases progesterone into the body. Hormonal implants can be inserted anytime within your cycle, provided you are not pregnant. Some side effects of the hormonal implant include headache, weight gain, breast pain, acne, mood swing. Of course, it does not interfere with sexual activities. It is highly effective and does not cause any delay returning to fertility. In all this method, you may still need to visit your care provider so that you can be properly guided and examined for the best method suitable for you. I'll be coming your way again next week. Just click the subscribe button, hit the notification bell so you don't miss out on this series. Thank you for listening.